As February is Heart Awareness Month or Heart Month, we have invited Dr. Caroline Lawrence, specialist in internal medicine and cardiology, to join us on Good Morning SKN to tell us how we can show love to our heart. Welcome, Dr. Lawrence.
Thanks for having me.
Welcome.
Good morning.
As I was saying before, you're such a good doctor because literally you were on call.
Literally.
Yes, so thank you.
And I answered.
And you
Not only that, I
answered.
was on call.
You were on call and you answered and you came to the studio. Thank you so much.
Thank you. We appreciate that.
All right, so as Hortensia just said, the heart is the epicenter of our health. Can you explain to us how important it is for our body's overall health?
Sure. So other specialists, like for the brain, might think, or the kidneys might think, no, they're equal importance. Of course not. So the heart, of course, is its main job is to supply the body with all the oxygen, nutrition, as you rightly said, that it needs. So of course the brain needs this heart to work, the kidneys need this heart to work, all our muscles, organs. So it is critical that we look after this organ. Some want to call it a pump. We don't care what you want to call it. Its job is to supply everybody, all parts of us, with what we need to survive. And I have seen a decent amount of abuse of people's hearts in this country, and I was shocked when I first came back home and saw I wasn't expecting to see this amount of heart disease. Wow. So yeah, it is important that we look after it as much and as best as we can.
So what are some of the leading causes of heart disease? Because we notice it can cause death.
Mm-hmm. So even in times of COVID, heart disease is still the leading cause of death. Wow. Even in times of COVID. I'm sorry, what was your original question?
Okay, we noticed that heart disease is a leading cause of death. Can you give us some of the causes of these diseases?
Of heart disease. Yeah. So the main thing, so can I reference my model? Mm-hmm. All right, so this is what a heart really looks like. So not the Valentine thing that we know and draw since we're small. This is what the heart looks like. And it sits in our chest just like so. So the peak or the apex of the heart is right here below or around the left breast. So the main killer causing heart disease is when these vessels that run on the outside of the heart, these are the vessels that supply blood to the heart itself. Okay. So these ones here take the blood to the body and return, but these are the ones that feed the heart. So the main problem why we still see heart disease as the leading cause of death is that when these vessels get blocked. So the heart feeds everybody, the heart feeds itself too. So when these vessels that run on the outside get blocked, then all inside stops getting the blood it needs, can't function. So that's called a heart attack. So that's the leading cause of what can go wrong with the heart. Some people, their heart get big. Some people, they have electricity problems. So there are different things that can make heart disease occur. But the leading one is these vessels getting narrowed or blocked.
Okay.
We know what the heart is, and we also saw earlier a demonstration of how the heart actually works. What I want to talk to you about now, Doctor, is some of the other diseases besides heart disease that could affect the heart.
Sure. So I kind of said some of them too, like hypertension and diabetes. So elevated blood pressure, high blood sugar, diabetes, high blood cholesterol can, yes, affect the vessels, which then can affect the heart muscle itself. Some of us are born with heart disease, so some children, clearly, when you talk about being born, so it would present typically in the neonate. Some babies are born with heart disease. So I reference the blood vessels feeding the heart. Sometimes, so everybody's heart is to have 4 chambers.
Okay.
Sometimes some children are born with no chambers on the left side, so they only have the 2. Some children are born with a hole in their heart, and that would mean then that the blood that is only supposed to go to the lungs to get oxygen is now going out of the heart with low oxygen because of that hole that allows for the transmission of blood. So sometimes it's congenital, things you're born with. Sometimes it's things like the common flu. So a flu attack, the influenza, not COVID, other viruses, other viruses can actually attack the heart and make the heart get an enlarged floppy heart and then can't work well and then go into heart failure. So yeah, there's several different types, not just about the blood supply, but things you're born with. High blood pressure can attack the heart and do a completely different presentation. So yeah, when we talk about the heart, it can get quite complex. Structural problems, electrical problems as well, and sometimes both.
So can you tell us what are some foods that are good for the heart?
Yes. So we're all to do good on our vegetable intake. I am very, very, very guilty. I don't like vegetables at all. But yeah, so vegetables and fresh fruits. So what's supposed to roll off my tongue is a diet rich in fresh fruits and vegetables. I like fruits, I don't like vegetables. Yeah, so vegetables and fruits. We're to avoid high cholesterol foods. So we're to avoid red meat. So that would be like mutton and steak and beef. Yeah, so those are to be once a month event. We're to avoid full cream cheese, full cream milk. So those are the other cholesterol bits that can.
Love those.
Yeah. I love those too. So when you talk about what foods, I know I'm going to cheat and have some of those foods that I'm not supposed to have. So then I go ahead and make sure I exercise.
Yeah, so you balance it off.
Yeah,
very
so I
well.
cheat.
Okay, good stuff.
And
So Jamie, there must be balance.
yes.
So
Balance is
it's
important.
okay to cheat as long as you make it up. Did you hear that?
Yes. No, I say that with. But then I know my numbers too. So I know my blood pressure is, I know my blood sugar is, and my cholesterol. So then, yeah. Yeah, but the fruits and vegetables and low cholesterol foods.
All right, so doctor, what happens at a heart checkup?
A heart checkup. So first, it's about finding if you have symptoms about heart disease. So we go into the history first. Problems to breathe when you exert yourself, or chest pain when you exert yourself. Problems to breathe when you lie down to sleep. Do you feel your heart doing funny beats when you're not exerting yourself? Do you see swelling of the feet, swelling of the ankles? So I go into the history first. Do you have any symptoms suggestive of heart disease? And then we do the physical exam, where I literally listen to what your heart is saying, stethoscope and story. And I only expect to hear 2 heart sounds when I listen to anybody's heart. Sometimes you hear extra heart sounds. So you're only supposed to hear doop doop, doop doop. Sometimes you hear doop sh doop, doop sh doop. Sometimes you hear doop.
They're playing a drum in there, man.
Yeah. And so I listen to the heart. I also examine the rest to see if there are any signs of heart failure, fluid collecting where it doesn't belong. And then sometimes if you have had no symptoms in the history and the physical exam, listening to the heart is normal, that's where your heart evaluation ends, because then you haven't given me any reason to do anything more for you. Sometimes we have to do the first screening test for heart disease, which is the electrocardiogram. Looking at the electricity in the heart. Sometimes we have to do an ultrasound of the heart called an echocardiogram. Sometimes we have to do a stress test. So it depends on what the history and the exam tell us to see if we need to do anything further for you or you're good to go.
Okay. So is the heart really the seat of love?
That's what they say. Okay. But I know you're supposed to love your heart.
Yeah.
So if it's of course, that's all the theoretical thing, but you're supposed to love your heart. You're supposed to love your heart. I have seen the heart pull through for many people who have abused their heart, and the heart's still loving them, working for them. But we need to start loving our heart more. We're doing the regular exercise. We're checking your numbers, pressure, sugar, cholesterol level, and exercise again. Yeah, and I mean the plug for the exercise is not just to throw that number, the word out there. We like to, at least coming from the American Heart Association, for fully grown adults, a minimum of 150 minutes of aerobics in a 7-day week. So 150 minutes minimum. That could be 3 days of 50. That could be 5 days of 30. That could be all once on that Saturday, 150 minutes. So whatever it is, at least try to get that 150 minutes of exercise every 7 days. And you're putting yourself in a nice position to look after your heart well.
I like that. And that's something that I will do as well. So February, don't look at me like that, doctor. Doctor was doubtfully looking at me.
I did 25 minutes on the treadmill today.
Oh, good. Kudos.
And you?
I did 20 minutes. I did 20 minutes yesterday morning, around 6 to 6:30. I parked my car outside, and I went for my run, and I came back, and I got to work.
Very good. And you?
I will be doing 60 minutes from 11 to 12. I promise you, I'm going to the gym between 11 and 12 today. Look out for me. I have some friends waiting for me there even.
Excellent, excellent.
Pictures, picture proof.
Excellent.
Indeed.